So welcome to 10th video of NEET-PG 2024 morning session recall questions. So starting with question number 91, nerve supply of external ear was asked. So there was pointing of A, B and C. As all of you know, this A part is supplied by ATN or auriculotemporal nerve. This B part, the central part, part around the meatus, anterior and posteriorly supplied by your facial nerve and vagus nerve. This means cranial nerve 7 and 10, and your this part number C part is supplied by GAN or greater auricular nerve. So the best option for this question is this part is by auriculotemporal, this part is by facial and vagus nerve, and greater part is by greater auricular nerve. So this is the lateral surface supply, nerve supply, auriculotemporal, greater auricular, facial and vagus, and this is the medial surface of the ear. This is lesser occipital upper part. This central part is again facial and vagus, and the most of the greater part is by greater auricular. So in the medial surface, the lesser occipital is the newer one, and auriculotemporal in the lateral surface. So these two are different, and rest of the things is same for nerve supply. Coming to question number 92, a middle-aged chronic alcoholic man presents to ER in collapsed state. He was on binge drinking for past few days, maybe 1 or 2 weeks, something duration was there. So basically in this case, you have to manage the case as a case of acute condition like Korsakoff psychosis or Wernicke's encephalopathy, etc. So in this condition, your treatment should be not only, even your binge drinking can cause hypoglycemia too. So your both vitamin B12, B1 deficiency and hypoglycemia should be treated together. So you have to give both IV vitamin B1 or thiamine along with dextrose infusion. So thiamine followed by dextrose infusion. Okay, so these two combination will be your preferred option. 93, in head impulse test, following finding is seen in right vestibular neuritis. For right vestibular neuritis, when you will rotate the head to right, there will be left saccade. So this is the answer. Okay. So on rotating the head to right, there will be left saccade. Question number 94, 8 weeks pregnant woman, there was symptoms of hyperthyroidism, increased T3, T4 but decreased TSH. So definitely this is hyperthyroidism primary, like it's maybe Graves' disease or primary hyperthyroidism, the treatment of choice. So currently she is in first trimester. So as all of you know, in first trimester, drug like methimazole, carbimazole is contraindicated. Even radioactive iodine ablation is not also the option. So the answer is propylthiouracil. Propylthiouracil can be administered in first trimester. Question number 95, which of the following instrument insertion is difficult in this patient? This type of chest x-ray was given. As you can see here, this radiolucent area that denotes trachea is deviated towards right. So here is the tracheal shadow. It is grossly deviated to right side. So in this patient, definitely the instrument which needs to enter inside the trachea is very difficult because of deviation of trachea. So among this, definitely NG tube passes through nasogastric, through esophagus into the stomach. So this is quite easier for this case. Laryngeal mass airway, it lies above the larynx, so easier. Indirect laryngoscopy, it's very easy to visualize larynx with indirect laryngeal mirror. Only thing, I think one option was there, maybe in between these two options, either endotracheal tube or tracheostomy. In this case, you have to enter into the trachea. Okay, so either it is endotracheal tube, you have to introduce the instrument inside trachea, whether it is tracheostomy or ET tube. So this will be difficult because of gross deviation of trachea. So the answer is either tracheostomy or ET tube, whatever was given in the answer. So please comment your answer below. And now this is about pediatric growth curves, about different development. So age wise, growth chart is given, you have to identify the particular organ or type of growth. So in this part, as you can see, up to the age of 2 years, there is growth is maximum, almost 100%. So this is nothing but brain growth, so brain and head growth of the baby. And in this, there was one part in this region around 2 years, another is after puberty. So this is nothing but somatic growth of baby. And this is first there is growth up to 5 to 6 years, then there is decline in growth, rather it decreases in size, that is lymphoid organ of children. So this is lymphoid organ growth. And lastly, this is gonadal growth, and the size of the gonads increases after puberty. Around 10 to 12 years it increases suddenly. So this is brain growth, somatic growth, lymphoid organ growth, and this is gonadal growth. So this is the image. As you can see, this is the brain growth maximum around 2 years of age, then almost static. This is general growth with 2 peak. This is reproductive. This is reproductive after puberty part starts. And this is lymphoid growth. This is lymphoid growth which decreases after a certain age. So these are the 4 graphs of growth for pediatric development. Coming to question number 97, singer having problem in high pitch. So there is problem in high pitch on examination. There is bowing of one side of the vocal cord. As there is bowing, it signifies loose vocal cord. So there might be something, there might be some problem in some muscle who is the main tensor. So problem in the tensor will cause loose vocal cord. So who is the main tensor of the vocal cord? Obviously it is cricoarytenoid. So as cricoarytenoid is affected, there will be bowing of the one side of the vocal cord, and there will be problem with the high pitch. Coming to question number 98, Sauer test is mediated by. It is, I think, kind of difficult question, new type of question with some dangerous option. So basically, according to my juniors, so this is TRPV3 channel. I think most of you can exclude this option TRPV3, because so many of you actually know this TRPV3 channel, because this is responsible for pain or also burning taste sensation. Okay, so this is for pain or burning taste sensation, metabolic receptor for noxious stimuli. But the deadly options are like this: GPCR T1R1 and GPCR T1R2, and among this answer will be GPCR T1R2. So this is for sour, and the question asked was sour, and this GPCR T1R1 is for sweet. And another fifth is, yes, this is umami. So sweet and umami by GPCR T1R1, and GPCR T1R2 is for sour. Question number 92, smoker male presented with hoarseness of voice, lesion shows in the vocal cord, some irregular lesion. This image might be different. This is just, I'm trying to give you the concept rather than the actual image. So smoker male with hoarseness of voice and some pathology in the vocal cord. They ask intraoperative which stain is used to view the following lesion to take the biopsy. It is nothing but toluidine blue. So during intraoral laryngeal surgery, microscopic laryngeal surgery, intraoperatively this toluidine blue is applied over the lesion, and the grossly strained area from where the biopsy is taken, it will be blue in color. Okay, this will be after applying the stain, it will be blue, and from that stained area the biopsy is taken basically. Okay, so this is the basics of this question. So question number 100, straightforward, taste bud in absent which papilla? This is kind of straightforward one-liner question. This is filiform papilla. Okay, the answer is filiform. So in the next video I'm going to discuss next set of questions. So kindly put down your comment which questions are already still remaining to discuss. Okay, so that I can recollect the question as early as possible and discuss. Thank you very much for your attention. Don't forget to subscribe my channel for more videos.